it is never too early to start thinking about organizing and packing your hospital bag. Whether you're planning to give birth in the hospital or at home, at around week 34-35, you may wish to start packing a few things together and getting ready. Even if you're not planning to go to the hospital, you may need to go in unexpectedly, so try to have your bag ready by the time you're around 36 weeks pregnant. What to take and how much is a matter of personal choice. There are many different ways to organize your bag. One suggestion is to divide it into 3 sections. Things you will need during the labor, bits and pieces for the time after the baby is born, and clothes you will need to go home in. Another idea is to separate the bag into 2 sections or pack 2 small bags, one for you and one for baby. A third option is the extra quick bag, if the baby decides to make an early appearance. Either way, remember that the space for bags in the hospital is limited and you will need to stay here for perhaps 1 or 2 days, so pack accordingly. If you are concerned about the longer stay, you can always pack a second bag to leave at home or in the car. An old t-shirt or nightie. You may prefer to throw it away afterwards. Giving birth is sometimes messy. Lightweight dark colored dressing gown. You will need it when you need to pass hospital corridors in early labor or later on in the postnatal ward. Socks. Your feet can get cold during labor. Slippers, preferably waterproofed and easy to get on and off. Hairbands or clip if you have long hair. Massage oil or lotion if you'd like to use it during the labor. Tense machine if you have decided to use one. And little things to help you relax. Music, magazine, or for example, lip balm. Snacks and drinks. Water and isotonic sport drinks are a very good idea, as well as some biscuits and chocolate to keep you going. You may also decide to bring some extra pillows. This is a very good idea. Just make sure that you're using the most colorful pillowcase you have. This will make it easy to remember and not to forget to take it with you when you go home. Your maternity notes. Pen and paper. You probably will be asked to sign different documents, or you may want to write down some important information. Front opening nightgown or pajamas. It will be very useful for breastfeeding and skin-to-skin cuddles. Old disposable or cheap cotton knickers. Maternity pads. Maternity pads are bigger, more absorbent and softer than the sanitary towels. You will probably need to change your pad every couple of hours, so bring 2 packs. Nursing bra and nipple cream. Breast pads. Whether or not you plan to breastfeed, the breast will start to produce milk. Toiletries. Towels, hairbrush, toothbrush and toothpaste. A going home outfit. Loose and comfortable clothes to wear. You have to also consider the weather for an extra layer. You might also consider throwing in a few plastic bags to put any dirty clothes in. If you're planning to take your camera, make sure that the battery is fully charged. Two or 3 sleep suits and vests in a range of size and colors. Cotton baby hat, maybe 2 or 3, very often part of a newborn set. Baby blanket. Although hospitals are very warm, your baby may need a blanket if it is chilly outside when you're leaving. Nappies. You may need as many as 10 during the first day. Make sure that you buy nappies for newborns and not the tiny baby ones, unless you've been told that baby might be little or premature. Cotton wool balls for changing baby nappies. Muslin squares for mopping up any milk your baby brings up. 1 outfit for the trip home. Baby car seat. It is not safe to travel without one. It's a very good idea for you to make sure that you and your birthing partner have already practiced how to use a car seat. Jacket or snowsuit for winter babies. An old t-shirt or nightie. your maternity notes, slippers, front opening nightgown or pyjamas, maternity pads, old disposable or cheap cotton knickers, 2 or 3 sleep suits and vests, cotton baby hat, nappies and baby blanket. Mobile phone and charger. Digital camera and mobile phone to take photos or short film of the birth and early moments with your baby. Extra snacks and drinks. I mean soft drinks. Trust me, dehydrated and hungry birthing partner is not the best support. T-shirt. It always feels warm in the delivery room and especially during the night. And last, probably the most important, don't forget to take with you your best smile and all the preparations you and your partner have done during the pregnancy. First of all, make sure you have arranged the transport to get to the hospital. You may need to go there at any time of the day or night. If you're planning to go by car, make sure it's running well and there is always enough petrol in the tank. If a neighbor has said they will take you, make alternative arrangements just in case they're not in. If you haven't got a car, make sure that you have a telephone number to call a taxi. Towards the end of the pregnancy, you may feel nervous about when you should call or go to the hospital. First labor will usually take slightly longer. Therefore, if you think that your labor has started, start to time your contractions from the beginning of one contraction to the beginning of the next contraction. When your contractions are regular and strong and come in every 5 to 6 minutes for 1 to 2 hours, you should start thinking about calling the unit. If you are 36 weeks of gestation and over, you have to call the birth center. The midwife will ask you different questions that will determine if it is time for you to come to the hospital. It depends on various factors, including how far you live from the hospital and how long it takes you to come here. The midwife will also take into consideration whether you have any additional concerns regarding the labor or you'd like to stay at home for as long as possible. If your waters have broken, you will be invited to come to the hospital for initial assessment. If you're having contractions, but your waters have not broken, you may be told to wait and come in when your contractions are regular, strong, about 5 to 6 minutes apart, and lasting about 45 to 60 seconds. Make sure you inform the midwife on the line if you have had quick previous delivery. Second babies often arrive more quickly than the first, so you may need to contact the unit sooner. Don't forget to phone the hospital or the unit before you leave home, and remember to take your maternity notes. If you're planning a home birth, follow the procedure you have agreed with your midwife during the discussions about the onset of labor, and make sure you have the right telephone numbers to call. If you're experiencing contractions or back pain, if your waters break or if you started bleeding, if you have not felt baby moving or you feel few movements, if you're having regular contractions, about 1 every 6 to 7 minutes for the last couple of hours, and you're less than 36 weeks but more than 20 weeks of gestation, you have to contact our triage unit. If you are still in early pregnancy, less than 20 weeks of gestation, and you're experiencing bleeding or regular contractions, you have to contact your GP or the A&E department.